I've been doing this informal survey for a while now, just asking people I meet a simple question. Did you ever get a real sex education class? I must have asked over 200 people by now, all ages, from 22 to 80, straight and gay. The answer, almost universally, was no, or not really. But one conversation in New York just crystallized the whole thing for me. I was talking to this guy, maybe 35, sharp, articulate, works in finance. The topic came up, and he got this really sheepish look, kind of laughed, and said, honestly, I am pretty sure I am still not putting a condom on correctly. He said it like he was admitting he couldn't tie a proper bow tie, just this quirky personal gap in his knowledge. And the really strange part, the more I looked into it, the more I realized he wasn't an exception. He was the rule. It got me thinking, we are drowning in sex. It's on every screen, every app, it sells everything. And yet in a city like New York, a huge number of grown men don't understand the absolute basics of protection and responsibility. How did we end up in a place that's obsessed with sex, but refuses to teach it? What that anecdote exposes is the failure of decentralized, often reactive, education systems to treat sexual health and literacy as a core public good. That knowledge gap isn't just a Western phenomenon. The same silence, the same deep-seated ignorance is a global challenge.
That paradox, the universal obsession juxtaposed with universal ignorance, is absolutely the critical starting point for this deep dive. The failure you describe, it happens when sexual health is marginalized, dependent on fragmented local school boards, or viewed primarily as a private moral failing.
Right, instead of a systemic issue.
Exactly, a systemic public health and competence issue. But when we pivot and look at a major power like China, the perspective changes entirely. We are looking at a systematic, state-led attempt to institutionalize a comprehensive response to this exact global knowledge gap.
And that's exactly what we're tackling today. Our mission is to, dissect the detailed structure behind this massive undertaking. How does a nation with the largest school population systematically develop and uniformly implement a national comprehensive sexuality education, or CSE, curriculum? We're going to examine the national frameworks, the specific learning objectives for students from childhood right up to graduation, and the innovative implementation strategies being used, especially in remote areas. This is a true top-down attempt to integrate biological facts with crucial psychological, ethical, and consent-based learning, fostering a more informed and healthy youth population.
The sheer ambition is what is so striking. I mean, this isn't just a pilot project or some kind of suggestion.
No.
It is high-level strategic mandate. And the key differentiating factor, I think, is that health education and, by extension, comprehensive sexuality education, it's not treated as a peripheral topic. It's elevated to a national strategic priority, woven directly into China's major long-term planning documents for the future.
This isn't just rhetoric, is it? This is about fundamentally shifting the institutional architecture for decades. We're talking about the Education Modernization 2035 plan, which articulates this concept of improving comprehensive quality and putting health in the first place.
Exactly.
When health is considered foundational to overall competence, on par with academic skills, that changes everything about how resources are allocated, right?
It really does. That strategic vision is then cemented by specific action blueprints, notably the Healthy China 2030 plan, HD 2030.
Okay.
HD 2030 is designed to shift the national focus from being treatment-centered, dealing with sickness after it happens, to being people's health-centered, with prevention as the primary focus, proactive. Crucially, this blueprint explicitly requires integrating health education, including elements of CSE, into the national education system at all levels. All levels, specifically focusing on primary and secondary schools. This elevates sexual health literacy from, let's say, a niche concern to a necessary step toward national well-being.
So the state isn't just suggesting this is a good idea. They are institutionalizing it through legally mandated, quantifiable policy goals. What are the specific legal measures that force this education into existence and, give it teeth?
Yeah, the mandates are becoming increasingly comprehensive and they require nationwide compliance. Consider the outline of children's development in China for 2021-2030.
Okay.
Goal 12, squarely placed under children and health, is unambiguous. Children of school age will receive universal sexuality education.
Yes, universal, that word.
Universal.
In the context of China's massive education system is staggering. It implies zero tolerance for gaps in access or quality.
Precisely. And the responsibility isn't solely dumped onto the schools, which is interesting. There's a mandated shared duty. The Law of the People's Republic of China on Family Education Promotion, which became effective in January 2022.
Relatively recent, then.
Very recent. It legally mandates that parents or guardians must pay attention to minors' mental health and educate them on essential safety knowledge, including the prevention of sexual abuse. This shifts some of the educational burden to the family unit, but within a regulated framework that ensures oversight.
That's a fascinating layer, bringing the family into the formal institutional safety net and the school's core duty that's secured by the updated Law of the Protection of Minors, I assume.
It is the ultimate safeguard. The Law of the People's Republic of China on the Protection of Minors, revised in 2020, requires schools to carry out age-appropriate sex education.
Age-appropriate?
Yes, crucial distinction. To improve minors' awareness and ability to protect themselves against sexual assault or harassment. This establishes a legal duty for the school system to provide protective education that is mandatory, ensuring institutions cannot simply opt out of teaching these crucial self-defense skills.
Right.
This is about building a system of care and prevention rather than just, waiting for problems to arise.
Okay, so one of the biggest challenges globally is finding time and resources for a separate sex ed course, right? It's often the first thing cut when budgets get tight. But China's system seems to avoid this problem by integrating the content. It's not a standalone class.
Correct. And that's a very deliberate design choice. The designers were keenly aware of the logistical constraints, the packed timetables. So instead of a separate vulnerable course, CSE relies on established carrier subjects.
Carrier subjects, like existing required classes.
Exactly. They are weaving these complex concepts into the required curriculum, guaranteeing comprehensive reach. This content is integrated into 4 key curriculum standards.
Oh, okay.
And the way they are split is quite telling about their structural approach.
Tell us how that integration works across those 4 areas. How do they distribute the different elements of CSE?
Okay, so the 4 key areas are physical education and health, science, morality and rule of law, and biology. If you look at the distribution, it makes a certain kind of sense. The biology standards handle, the anatomical and reproductive health elements, the science of it. The physical education and health standards often address healthy lifestyle choices, hygiene, and immediate self-protection skills. More practical, body-focused stuff.
But the more complex social aspects, things like consent, relationships, ethical behavior, where do those fit in? That doesn't immediately sound like PE or biology.
That's where the morality and rule of law curriculum standards step in.
Oh, okay. Makes sense.
This is where students learn about the legal requirements for relationships, the illegality of certain acts like child marriage, forced marriage.
Things we'll touch on later, I think.
Yes. And the importance of respect and civic responsibility within intimate relationships. It turns relationship ethics into a matter of civic education almost. And I found it particularly interesting that even in the senior high curriculum, they mandate effective prevention and response to sexual harassment and abuse be included within the biology standard.
Within biology. That's unexpected.
It is, isn't it? It's a clear merger of traditional physical sciences with modern ethical and safety competencies. It shows that body knowledge is intrinsically linked to boundary knowledge. You can't separate them.
That connection of physical science with ethical behavior really emphasizes the structural shift we mentioned earlier. This whole system aligns with the broader movement in Chinese education toward defining subject core competencies.
Exactly.
What a student must know and be able to do to function effectively.
Absolutely. This structural alignment is key to its success, I believe. For mathematics, those competencies include, say, logical reasoning and data analysis.
Sure.
For sexuality education, the core competence is framed as holistic health and responsible participation in society. This system aims to produce citizens who are not only academically capable, but are also emotionally literate and ethically grounded, which leads us perfectly into defining what this comprehensive sexuality education actually is in their context.
Right. If it's so much more than just reproductive biology, what exactly is the official definition of CSE used in China? What is the goal here?
The guideline used defines CSE as equipping children and young people with the necessary knowledge, skills, attitudes, and values. It's a mouthful.
Okay.
That will empower them to realize their health, well-being, and dignity.
Dignity, that's a powerful word there.
Isn't it? And also to develop respectful social and sexual relationships, consider how their choices affect others, and understand and ensure the protection of their rights throughout their lives. It's a vast, holistic definition.
That focus on dignity and respectful relationships, it really elevates the curriculum beyond purely functional knowledge, doesn't it? It makes it a moral and ethical training program as well.
It does. And when we itemize the rich connotations of sexuality education under the government's guidance, you really see its massive breadth. The scope includes not only the basic human body and development and sexual and reproductive health and rights, SRHR.
The expected stuff.
The expected stuff, yes, but also healthy lifestyle and hygiene habits, complex interpersonal relationships and self-protection skills, values of respect and equality, and critically practical preventative measures like prevention of AIDS and STIs and safe sex practices. It's a fusion of physical well-being, emotional literacy, and civic responsibility. The aim is for it to be holistic, scientific, standardized, and localized, all at the same time.
That's a tall order. And this design philosophy ties back to the national pedagogical goals. You mentioned the three-dimensional goals used to legitimate curriculum reform across the board. Can you unpack what those are and how CSE satisfies them? Because that sounds like the structural engine driving this whole project.
It really is. That's the core design philosophy, legitimating change in classroom quality across the entire Chinese curriculum, not just CSE. These three dimensions are: 1, knowledge and skills. This is the explicit factual content, knowing how the body works, knowing the legal age of consent, knowing how STIs are transmitted, the what.
Okay, the facts.
2, process and method. These are the skills used to acquire and apply that knowledge, critical thinking, communication skills, decision-making, assessing risk.
Right.
The how.
Right.
And 3, affection, attitudes, and values. This is the ethical and emotional framework developing empathy, respecting differences, appreciating human dignity, and holding accountable attitudes toward one's own health and relationships. The why, or the so what.
Okay, so if a school only taught anatomy, it would only satisfy the first goal, the what.
Pretty much.
But if they teach anatomy alongside how to negotiate safer sexual behavior and why showing respect is important, they hit all three dimensions.
Precisely. CSE is uniquely positioned to satisfy all three. For instance, when teaching about HIV prevention, the curriculum doesn't just deliver the fact that condoms prevent HIV knowledge. It also teaches students how to support someone who might need testing that's a process method, a communication skill.
Right.
And it instills values like fighting stigma and discrimination associated with HIV, which falls under affection, attitudes, and values. By aligning CSE with these national goals, the state essentially treats emotional literacy, relationship management, and respect as measurable learning outcomes.
Measurable, like math scores.
In a way, yes. Ensures they are not optional extras, but crucial characters and key skills required for complex modern life.
Okay, let's move into the granular detail, the curriculum progression itself. This is where we see how they build that competence over time. We're looking at a spiral curriculum, you said. Increasing complexity across three major themes: relationships, gender, and skills for health and well-being. Let's start with relationships. How do they teach relational ethics and safety, particularly early on?
It starts quite early and focuses on developing foundational empathy and understanding difference. In the upper elementary stage, ages 9 to 12, the key idea is handling difference, stigma, and discrimination.
Before things get too complicated, hormonally speaking.
Exactly. The objectives ensure students know the harm caused by teasing or making fun of differences. They learn that every human being is unique and valuable. And crucially, they are taught practical steps on how to respond to and stop harassment and bullying based on differences. Various ways to intervene or get help.
So building a culture of basic respect before puberty really kicks in.
That's the idea. Then, moving into junior high, ages 12 to 15, the content has to leap forward, dealing with more mature concepts like responsibility and societal structures.
Right. Relationships become more central.
They do. The focus shifts significantly to responsibilities and long-term commitments and the boundaries of legal relationships. Students learn about the key responsibilities that come with long-term relationships and potentially marriage down the line. Furthermore, and this is a critical protective measure, they are taught the negative consequences of child, early, forced, and mercenary marriages.
Mercenary marriages.
Marriages for profit or exploitation. And importantly, they're taught that these are illegal under Chinese law.
So legal literacy is built right in.
Yes, and it's highly practical. The education empowers them to identify a trusted adult or institution, like the local public security authority, the police, to speak to if they or someone they know are at risk of such a violation.
Giving them concrete pathways to seek help.
Exactly. Then, by the time students reach senior high, ages 15 to 18 plus, they are expected to be capable of some pretty high-level analytical thinking about power dynamics and relationships.
Okay, so moving beyond just rules to understanding the why.
Absolutely. At this stage, the objectives require students to critically analyze how inequality and imbalance in power within relationships can actually be harmful. They are also taught to recognize the profound connection between rigid gender norms and stereotypes, and how those structures can lead directly to intimate partner violence.
Wow.
The goal here is critical social literacy, moving beyond individual acts to understanding the structural roots of relational harm.
That's quite sophisticated. Now, let's pivot to the gender and diversity theme. This is often a flashpoint globally, isn't it? What level of modern concepts of identity and rights are included in this centralized curriculum? Is it conservative or?
Well, what stands out is how modern and inclusive the guidelines actually are, framing these topics not just as identity issues, but as matters of human rights and social justice. In junior high, 12-15, students delve into definitions. They learn about gender identity and gender expression and the differences between those two concepts.
That does give terminology.
Yes. And crucially, they're explicitly taught that beliefs about gender roles and gender norms are often created by societies and can change.
That's a big statement within a state curriculum.
It is. It institutionally acknowledges the social construction of gender, pushing back against static traditional views.
And how is the inclusion of sexual minorities handled at the senior level? That's often even more contentious.
In senior high, 15 to 18 plus, the curriculum takes a clear human rights approach. The objective is for students to acknowledge that lesbian, gay, bisexual, transgender, and intersex, LGBTI people, have human rights and should be respected.
Explicitly stated.
Explicitly stated. Furthermore, they are tasked with analyzing how stigma and discrimination impact individuals, families, and society as a whole. And this is linked back to the legal framework, ensuring students understand China's laws and policy directives against stigma and discrimination.
So it frames respect not just as a nice idea, but as a civic requirement backed by law.
That's the framing, yes. A civic requirement, not merely a personal opinion.
Okay, shifting now to the third theme. Skills for health and well-being. This sounds like where the practical, life-saving decision-making skills really come in.
Right.
What are the key skills taught in junior high?
In junior high, 12-15, the focus is heavily on supportive action and emotional management. For example, they are taught to identify specific, helpful ways to be supportive of someone who may want to get an HIV test.
Supportive action, not just facts about HIV.
Exactly. Including how to help someone overcome personal fears about testing and recognizing the importance of early detection and antiviral treatment. It's about destigmatizing and enabling help-seeking. They also learn how to assess and manage the complex emotional factors, like peer pressure, perceived expectations, romantic feelings that influence sexual behavior decisions.
Moving beyond simple just say no.
Right. Shifting the paradigm from purely fear-based teaching to informed, managed choice, understanding the emotional landscape.
And the final stage, senior high, 15 to 18 plus, presumably provides the ultimate layer of practical competence, centered on evaluating consequences and building refusal strategies.
That's the capstone of the skill development, pretty much. At this level, students are expected to analyze the full spectrum of positive and negative consequences of various sexual behavior decisions, and understand how these choices affect their long-term life plans, academic goals, their financial future even.
Real-world impacts.
Very much so. Most critically, they must learn to be able to effectively refuse unprotected sexual behavior and other high-risk activities in intimate relationships. Concrete refusal skills.
Practice, presumably.
The curriculum encourages participatory methods, so yes, ideally practice. They are also informed in detail about national laws that explicitly affect what minors can and cannot do related to sexual behavior.
So they know their rights and responsibilities legally.
Exactly, ensuring they are legally literate.
This meticulously detailed, nationally mandated structure, it suggests an immense logistical challenge. I mean, the scale is just enormous. How does this cohesive national system manage the sheer scale of delivery, particularly in, say, rural or remote regions where specialized teachers and resources might be scarce?
Yeah, the scale is the challenge, but the centralized nature of the system is also the crucial advantage here. Centralized coordination allows the Ministry of Education to mandate coherent design across everything: curriculum goals, textbook production, teacher training, assessment.
Standardization.
A high degree of standardization. Textbooks are universally reframed according to those subject core competencies we discussed. Furthermore, training for teachers is systematically arranged at both the national and local levels, ensuring a standardized baseline of instruction quality.
What kind of training? Is it just lectures?
The guidelines emphasize training teachers in participatory methods, moving away from simple lectures. The goal is to ensure students gain agency and actually practice these complex communication and decision-making skills.
Okay, but even with mandatory training, it must be difficult to maintain quality control when you have huge distances separating schools. How do they bridge that geographical gap? How do they ensure a student in a remote village receives the same quality instruction as a student in Shanghai or Beijing?
This is where we see true innovation leveraging technology. UNFPA China, in partnership with Maurice Stopes International China, MSIC, piloted a highly effective project using digital infrastructure.
Technology.
Specifically, live streaming. To deliver high-quality CSE instruction in remote regions like Qinghai, Sichuan, and Yunnan provinces, places where access is traditionally very limited.
Live streaming CSE. That's an ingenious solution for reducing cost and ensuring standardized quality across vast distances. What was the exact structure of that pilot? How did it work?
Well, the primary goal was exactly that. Drastically reduce cost, maintain high instructional quality, and expand accessibility where finding trained, specialized instructors on the ground is really hard. The pilot delivered a structured, high-quality 8-session course.
8 sessions?
Yes, delivered via live stream to over 2,300 adolescents across 5 schools in these remote areas. The centralized instruction ensured every student received the exact same scientifically accurate and ethically aligned lesson plan from a well-trained instructor.
Okay, the tech makes sense for standardization. But did this remote online delivery actually resonate with the students? I mean, talking about sex is awkward enough in person, let alone on a screen maybe. What were the measurable results?
Well, quantitatively, the results were pretty stunning. The instruction led to an 80% increase in knowledge on the role of condoms in preventing HIV among the participating students.
An 80% increase. That's huge.
Massive. A massive, life-saving leap in knowledge retention. But you're right, the qualitative feedback is equally important for understanding how they overcame those cultural barriers you mentioned.
Yeah, the cultural barrier of discussing sex publicly is immense everywhere, but particularly perhaps in more traditional communities. How did the online format impact that? Did it make it worse? Better?
It seems to have made it better, surprisingly. It provided a necessary layer of anonymity and distance. Students actually appreciated the online format. One 9th grade student noted, quote, "It's not so embarrassing when the instructor is on a screen."
Interesting. The distance helped.
Exactly. This finding is profound. The digital distance reduced the perceived personal shame or embarrassment associated with the topic, allowing students to engage more freely and perhaps absorb more. Other feedback included a student realizing sex wasn't as scary as I thought, and others confirming that they had finally learned how to talk about sexuality in a structured, safe environment, something they lacked before. And look, this intervention was addressing an acute, documented need. School principals involved in the pilot noted the urgent necessity. One principal lamented that some students had, quote, zero knowledge on CSE, literally zero, and that some girls didn't even know what was going on when they first got their periods. Basic biological facts were missing.
So the live streaming wasn't just convenient, it was filling a critical void.
Precisely. The live streaming pilot worked because it reached the most marginalized populations with effective, high-quality, standardized information that traditional, localized methods had completely missed.
This entire system, being so integrated into the legal framework, suggests that the curriculum is also a critical component of state-mandated safety. We need to detail the comprehensive approach to protecting minors from sexual abuse and harassment that is built into this CSE mission. It's not just education, it's protection too, right?
Absolutely integral. The systemic protection of minors is woven throughout. The state mandate requires schools to establish rigorous working systems for prevention. Crucially, they are legally prohibited from concealing illegal acts. Schools are required to report immediately to public security, the police, and the Educational Administration Department if they suspect abuse or harassment.
No sweeping it under the rug.
It aims to eliminate the institutional silence and localized cover-ups that too often protect abusers in other systems. Mandatory reporting with teeth.
And once a report is made, the system must protect the victim from further distress, presumably. Prevent re-traumatization.
Yes, the focus shifts immediately to preventing what is termed secondary victimization. The government is strengthening the mandatory reporting system and establishing a one-stop evidence collection mechanism for minor victims.
One stop. What does that mean?
It means a coordinated approach. Instead of the child having to tell their story over and over again to police, doctors, counselors, social workers.
Which can be incredibly traumatic.
Exactly. This mechanism aims to have evidence collected and interviews conducted in a single, coordinated, child-friendly setting to minimize distress. The priority is making the process seamless and supportive.
What other mandated support is available for victims and their families within this institutional framework? Is it just the reporting and evidence collection?
No, it's broader. The law mandates the provision of timely psychological counseling, robust family support, helping the family cope and support the child, and necessary legal aid for victims and their families.
So mental health, family, legal support.
A holistic support structure. Furthermore, the system mandates school transfer assistance if the current school environment is deemed unsafe or harmful to the minor's well-being after an incident.
Allowing them a fresh start.
Yes. It is a comprehensive protective infrastructure built around the education mandate, ensuring that protection and education work hand in hand. They're seen as two sides of the same coin.
We've established that this institutional approach is incredibly comprehensive, systemic, and driven from the top down. It's quite remarkable in its scope. To truly understand why this curriculum is so structured and maybe collective in its focus, we probably have to look at the foundational philosophy, the cultural background of China's commitment to structural equality, perhaps.
That historical context is vital, I think. To understand why CSE is so heavily institutionalized, we really should look at China's historical socialist feminist legacy. Unlike many places where feminism might be viewed through a purely individual lens, maybe focused on individual rights or choices, in China, women's liberation was integrated into the socialist revolution from the very start. It was about institutionalizing gender and class equality simultaneously. The structure was paramount.
That sounds like a fundamental difference in prioritizing structural change over perhaps individual liberty as the starting point. You mentioned institutions like the All-China Federation of Democratic Women being established very early on.
Precisely. The All-China Federation of Democratic Women, or ACWF, established way back in 1949, promoted the Marxist materialist view that women's emancipation hinges not just on awareness or individual awakening, but on participation in social production work and securing institutional support. It frames the issue as collective and economic, not purely personal or moral.
And this historical framework contrasts sharply with the individualistic approaches often seen in, say, liberal Western feminism. What was the intellectual critique that arose in China, particularly in the post-Mao discourse, regarding those approaches?
Well, some Chinese scholars observed that Western-centric feminism, or at least certain strands of it, often prioritized individualistic subjectivity or focused heavily on sexual difference, sometimes becoming detached from the political and economic context.
Okay.
The critique suggested that detaching gender issues from the structural context, the actual institutional roots of inequality, could sometimes lead to what they termed gender blindness or an unnecessary focus on adapting to the male standard without fundamentally dismantling the unequal structures.
So if the focus isn't absolute individual autonomy as the primary driver, where does agency, the power to make choices, ultimately come from in this philosophical context?
Right.
How is agency understood?
The structural view asserts that genuine individual agency isn't just born in a vacuum, It's seen as contingent on and embedded within the dynamic interplay of political, institutional, cultural, and individual factors.
Okay, that's a bit academic. In simpler terms.
In simpler terms, you can't fully liberate the individual or empower them to make genuinely free choices without first building the institutional and political support structure around them.
So structure enables agency rather than agency existing separate from structure.
That's a good way to put it. The goal is structural support and institutional empowerment for all, ensuring that knowledge and rights are universal public goods, accessible to everyone, not just private knowledge acquired by chance or privilege. And this deep-seated commitment to structural equality and collective health perfectly explains the resulting CSE curriculum we've been discussing. It explains why it is so comprehensive, so institutionalized, and so focused on responsibility, rights, and ethical conduct for the whole population. This reflects the view that achieving genuine well-being for a massive population requires treating sexual literacy not as a private matter or a moral issue alone, but as an institutional public health project vital to social and economic flourishing.
What an incredible journey. We started with that that jarring image of a highly successful adult in a major Western city admitting to a fundamental gap in sexual health knowledge, which really highlighted a massive global failure of decentralized, maybe under-prioritized systems. We've moved from that anecdotal failure to examining a systematic, nationally coordinated attempt to integrate comprehensive sexuality and health education right into the core competencies of millions and millions of students in China.
The synthesis is clear, I think. China's approach, driven by these national health blueprints and that strong, centralized institutional coordination, it reframes sexual education entirely. It's seen as a fundamental component of competence for students' future.
And competence, like math or literacy.
Exactly. It is categorized as a crucial character trait and a key skill for citizens, sitting right alongside traditional academic subjects like mathematical modeling and data analysis in terms of importance for national development. This centralized approach, utilizing innovative methods like live streaming to bridge those massive geographical divides, aims to ensure that knowledge about relationships, rights, and sexual health isn't left to chance, or awkward conversations, or the internet, but is intentionally delivered and uniformly accessible to everyone.
This integration of comprehensive sexual and emotional literacy into a centralized, competence-based curriculum ultimately shows, perhaps, that achieving genuine well-being for a massive population requires treating sexuality not as a moral or private failing, but as an institutional project vital to social and economic flourishing.